joining me this evening. We are going to be learning about tuberculosis, otherwise known as TB. I hope you are going to learn something, right?
Yes, ma'am.
Thank you. First, what is tuberculosis? It is a disease caused by a bacteria called Mycobacterium tuberculosis. It affects the lungs, but can also affect other organs such as your kidney, your brain, and your spinal cord. So, what are certain risk factors that can make you be susceptible to this disease? You're elderly, you are healthcare workers. Since we're nursing students, we're susceptible to this. You had a previous TB infection. You might have HIV, or you might be diabetic. Those diseases that suppress your immune system. You are poor, and those of us, or those people who use injection of illicit drugs. Don't make it fun. So, how does TB spread? When a person who is contaminated coughs, sings, or talks to another person, droplets come from the person's saliva, and the other one can breathe in and also get infected. Our epidemiology and stratification means that 1/3 of the world's population are infected with tuberculosis. It affects more men than women. Asians have the highest rates, while white people have the lowest rates. It is also the #1 killer of people who are infected with HIV and AIDS. Some common signs and symptoms that we'll have if you were infected with tuberculosis: you will have a bad cough that lasts for 3 weeks or longer. You will also have fever, chills, malaise. You will sweat a lot during nights, and you will lose appetite, and you will also lose weight. I hope you guys are understanding me. All right. Remember that 70% of these cases are from ages 15 to 54 years, and 63% of these cases are from foreign-born. I mean, those people that are not born in the US, like Philippines, Africa, China, those people. Now on to our diagnosis, treatment, and what's that I wrote on there? Well, diagnosis.
Prevention.
And prevention. Thank you, Ms. Shannon. You are paying attention. Right? First, you have a sputum test. You have to have 3 of them for culture. Then you have a blood test, which is the interferon gamma assay. And then you get the chest x-ray. For treatment, you have a cocktail, the antibiotic cocktail. The first one is rifampin. The second is isoniazid. The third is pyrazinamide, and the 4th is ethambutol. Those you have to take for 6 months. Next, we have prevention. Our most prevention would be make sure you get yourself tested. As us nursing students, we're always tested every 6 months, so it's good for either any one of us to go get tested, so we know if we have it or not, and that can help our community. For our dimension of health, it affects you in 6 ways. That's physically, you get exerted, you get tired, you don't do the same things that you used to do before. Emotionally, you have stress, and because of stress, your immune system can go down. Spiritually, you might become stronger, and you might believe in God, knowing that He will be able to heal you through these medications. Intellectually, you might miss out of school, out of work, and sometimes get quarantined for 6 months. You may also stop taking your antibiotics because you feel better, which is not the right thing to do. You need to take the full course of the medication. Environmentally, a person may unknowingly begin to sneeze from allergies or cough or choking, or just saying hi to your friend, and because that friend is standing there, they might also get infected. Shannon and Dominic, I feel like you guys are not paying attention. Am I not entertaining you guys?
No, actually you're not.
Not really.
Do you think you can do better?
I think so.
Yeah.
I think so.
Show
Shout out to HBU, Dogs Up, Millennium Cohort, class of 2014.
Miss Moore class, video teaching project, tuberculosis, y'all.
We don't know how to sing, or we don't know how to write songs, but we about to do this for y'all, so listen up. So much info from the CDC, it's kind of hard being ignorant about TB, but somehow, some way, keep coming up with one new case like every single day. Greater Houston area alone, yeah, here are a few of the groups who have the highest risk of being screened so they won't be passing it on. I got smokers and the elderly and foreign born, and people with immunity that's dead and gone. And what we want to do, shoot, I got a plan of working healthcare and my homegirls too. So put on your mask and close the doors to contain, cause it's airborne. And we gonna take some tests for this. Dogs up, hold it down while y'all nursing students bounce to this.
We're getting down the rate, spreading info. This is what nurses do since way back. With my mother for prevention, cause prevention is the key. Now that we got people listening, everybody's got their test. Man on TV skin, not a type of test needed more than one time. You gotta get yours and I gotta get mine. Everything's not fine when you're looking at MTV. You got the indurated redness between 5 and 15. X-ray, the next thing we see. Sputum test is the best and you gotta get 3. And a sample of the blood test, my ladies. For the infra gamma assay. Killer disease, diagnosed TB, raising up the chance to be free. If you take all of these, and please, if you feel better, don't stop taking these before we're done. Because we are bringing down the rate, spreading info. This is what nurses do since way back. With my focus on prevention, cause prevention is the key.
Later on you may be coming to stay if the meds don't clear it all away. The infection is stronger, now it's gonna take longer just to go. Shoot, it ain't no joke, yo. Stay on top of it and take your drugs now. Negative pressure room, isolation now. Ain't no leaving, you're still breathing. Spreading this bacteria to various people, airborne. This is where it stops. Cause when we stop the spread, the bacteria is lost. Don't let it rest when you're down the road. People need to know we about to go.
Bringing down the rate, spreading info. This is what nurses do since way back. With my focus on prevention, cause prevention is the key. Bringing down the rate, spreading info. This is what nurses do since way back. With my focus on prevention, cause prevention is the key. Bringing down the rate, spreading info. This is what nurses do since way back. With my focus on prevention, cause prevention is the key. Bringing down the rate, spreading info. This is what nurses do since way back. With my focus on prevention, cause prevention is the key. Bringing down the rate, spreading info. This is what nurses do since way back. With my focus on prevention, cause prevention is the key. Bringing down the rate, spreading info. This is what nurses do since way back. With my focus on prevention, cause prevention is the key.
Y'all better tell somebody about tuberculosis. It's free.
Thank you. That was quite informative of you. But you guys forgot one important information, which is the rehabilitation goals. And our main goal is for these people to attain a previous level of function, what they used to be before. Not the weakness, not the coughing. Suppose they took all their medications and everything is fine. That's our main goal. And we can do this by directing them to cdc.gov, which has all of the information about diseases, especially tuberculosis. We can have pamphlets for them, booklets, podcasts, and little flyers. Which can be very, very helpful. So, thank you guys for this beautiful, beautiful presentation. Very unexpected. Tuberculosis is one of my favorite subjects. Good night.
Yeah, I think
Show
so.